News 8 is on call for you, addressing your questions about coronavirus. You posted them on the News 8 Facebook, and Dr. Ajay Kumar, Chief Clinical Officer with Hartford Healthcare, answered them.
Chuck asked, how can avoiding crowds save lives?
What we're trying to do is reduce the droplet infection, that if somebody sneezes or coughs who is a potential COVID-19 carrier or a patient can spread it to a large number of people.
Andrea wants to know, are gyms safe?
Gyms are the place where you could possibly have fomite or the germs which could be transmitted from the equipment individuals are using. What I would advise is that people should use the gym with a lot of caution. Clean the surface after or before you use. You inquire with the gym, is there what kind of cleaning practices they have.
From Kathleen, if you get coronavirus, are you immune from getting it again?
We don't know that yet because it's so new in our system at the moment. We don't know how our immunity will react to that at this time. So at this time, it's very early to comment on that.
Jess asked, what is the treatment for someone who tests positive?
So it depends actually. If you test positive, you could be very asymptomatic and all you need is plenty of fluid and some acetaminophen and ibuprofen and take some rest. And it could be the other spectrum is very sick and you require intensive care or hospital visits or hospital care. And at that time, it's generally supportive. You're provided because the lungs react differently. You get short of breath. Your oxygen capacity to be able to get to the blood gets reduced. So supplement with oxygen, provide fluids, and make sure the individuals are supported.
Derek sent this in. Do people with asthma have a greater chance of getting coronavirus?
If you're taking steroids for the asthma, you're taking prednisone or medications like that, and some patients end up taking those kind of medication, you could be at higher risk because your immune suppression, you may have some sort of a reduced immunity. But if you're taking inhalers and you have a well-controlled asthma, you're not at any more increased risk than anybody else.
From Ruth, should we not be traveling to other states?
If you have a non-essential travel, I would avoid it at this time. If you have essential travel defined by your personal needs and how you take all the precautions you can at the moment.
LC asked, are you at higher risk if you're pregnant?
Pregnancy is not considered to be high risk at this time. However, I would be cautious in how you're traveling and where you're going. And pregnancy comes in different shapes and forms. Individuals have different challenges. I will highly advise that pregnant individuals should communicate with their primary care physicians or OB/GYN at this time as well.
When it comes to testing, Dr. Kumar admits that has been somewhat confusing and challenging, but says they are working closely with state officials and other labs to streamline that process. Hartford Healthcare's drive-through testing pilot program is not yet open to the public, but that could happen, though, next week. If you have a health question, send it to News 8 on call at WTNH.com. Jocelyn Mamenta, News 8.